Navigating COVID-19 for Moms and Babies. My name is Abby Bixler, and I'm the Manager of Policy and Advocacy for Generate Health. So we're recording the beginning portion of this session, and as you can see, it's a little bit different than we've done in the past. So we have you all here is more of a meeting rather than a webinar so that we can have a little bit more interaction. So to kick it off, a little bit about Generate Health. Generate Health is a maternal and child health coalition. We were founded 20 years ago, and our mission is to mobilize the region to advance racial equity in pregnancy outcomes, family well-being, and community health. We see our role in this crisis to convene the maternal and child health community to share information about how people who are pregnant, postpartum, are at risk for COVID-19, coordinate resources that respond to the needs of service providers and community members, and identify collective action opportunities. So we are focusing on that last one today because on August 4th, Missouri has an opportunity to break down one major barrier to healthcare for over 230,000 Missourians. As maternal child health professionals, this can make a huge difference in the health outcomes for moms and babies in our state, particularly for moms and babies of color. So it is vital that each of us do whatever we can to pass Medicaid expansion. So as I mentioned, today's webinar is a little bit different from the past 13 webinars that we've hosted, and we will be focusing today on Medicaid expansion. So rather than simply providing information, we want to give you all an opportunity to prepare to take action over the next 2 weeks. So we're going to start this webinar by hearing from Angela Brown, who is going to give us some information, really brief overview of the campaign, share some opportunities to work with the campaign to get out the vote on August 4th. And I'll also be briefly sharing a toolkit that we have put together that's focused on infant maternal health and Medicaid expansion. Then we're going to break out into small groups and kind of dig into this. So we're going to be led by the wonderful Generate Health staff, and you will have an opportunity to work on creating your personal why that you'll be able to share with your networks and those around you. And you will also have an opportunity to figure out where and with whom you can share your why to help get people to the polls on August 4th. So again, please remain muted unless it's your turn to speak. We'll have an opportunity to ask some questions of Angela if necessary. There is a way to raise your hand, which we'll be using. So we'll use that to help make sure that you can get your questions answered. You can also use the chat box as well to ask questions. So without further ado, I'm going to hand it over to Angela Brown.
Thank you, Abby, and good morning, everyone. Thank you all for having me on the call, and also thank you for joining. As Abby mentioned, I'm Angela Brown. I'm with the St. Louis Regional Health Commission, and we are an organization that has definitely endorsed Medicaid expansion. And I'm also a participant, a champion for the Yes on 2 initiative campaign. It's really focused at getting information out to our Black and Brown communities. So we understand that this issue, as Abby mentioned, is a major step towards addressing racial equity and disparities in our region. And so we want to make sure that those who will be most impacted by this new policy are out there, have the information they need to make the choice to vote. So definitely just to tell you a little bit about Healthcare for Missouri, who is now called Yes on 2. They are a coalition of voters, patients, medical professions, business leaders, and organizations that are committed to expanding access to healthcare to the more than 230,000 hardworking Missourians who can't afford to see a doctor right now. The core value and vision of this group is to really prevent individuals from having to choose to pay for life-saving care, which causes them to prevent care and not get the necessary treatment that they need. And choosing that over whether they do other things like pay bills and put food on the tables. We understand that many of the individuals who are unable to afford healthcare are actually working. Individuals who work for jobs that do not provide health insurance. And many of these workers are the frontline staff that were considered essential workers during this time during COVID. So definitely essential but not expendable. And we want to make sure they have the necessary coverage in order to get the healthcare services they need. So Medicaid expansion is what we see as a solution to ensure affordable health coverage. So if you or your organization has not signed on to be part of this organization, please go out to yeson2.org. A lot of information that I'll review today, also a toolkit and opportunities for you to sign up to get the weekly updates. I think they're daily now, updates about what you can do to be a part of this movement. So definitely as a champion, some of the things that kind of highlight what you can do. Officially today, we are less than 2 weeks away, so 13 days away from the vote for August 4th. Understanding that even with COVID, these are challenging. So I also want to talk through some points about safe voting. But for you as an individual, you can go out to Yes on 2 and sign up to make calls to voters. You can even start by calling or texting 10 of your friends and asking them to text 10 of their friends to really get out to vote for Yes on 2 for Medicaid expansion, leading with that this will bring home dollars to our state as well as help individuals have access to health care. And we talk about this in 230,000 working Missourians that will have access to health coverage. This includes 36,000 African-American Missouris that will have access to the much needed care. So definitely as you are talking to your friends, to your peers, to your church family, to people you see at the stores, anywhere you go about Medicaid expansion, definitely stressing some of those points. You can write letters of support to your to the editor of your local newspaper. You can also do social media posts. We know this is hard to kind of do speaking with COVID, so social media has been a big way that we have been working to get out the vote, to get people out to vote for August the 4th. So any of those things, anybody in your circle that you know is definitely a way to start to make sure they have the information that they need to get out and vote. And from working on this, there are a lot of just people that you run into every day that don't understand Medicaid expansion or that is on the ballot for August 4th. So even within your own networks, there's a lot of work that can be done to inform and educate people about Medicaid expansion and the importance of voting. Also, yard signs are now available from the campaign. I know Urban League is one of the sites, and they have 2 sites. So if you go out to yeson2.org, definitely look at some of those sites about where you can pick up yard signs. If you email me, and I will drop my email in the chat, I can definitely connect you with the Yes on 2 people to make sure that you have yard signs that you put in your yard, at your organizations, or other places to get out to vote. And so again, if you are with an organization, we still are social medias that you have, media requests. So any kind of communications that you have within your organizations, please utilize those in order to get out the vote, to make sure people are aware of this to your different constituents. So some of the key messaging components that the campaign is using is starting with Vote Yes on 2, so that on August the 4th, we all know that Missourians will have the opportunity to decide to vote. We're hoping to follow Oklahoma, who was able to pass the vote last month on a yes vote for Medicaid expansion through their ballot initiative. So really an important time for us to get out the vote. We understand this was moved up from November. So it is a primary where there may not be a lot of things for people that they would consider in voting on for August, but making sure that we stress the importance of that. Some of the key things about the money, this brings home dollars to our state that has been funding other places that have expanded Medicaid, like California and New York. So really want to be able to take advantage of some of those funding opportunities. It helps our economy, not only to create jobs, but also save jobs for our healthcare workers. And then it also helps keep our hospitals open. Many of the rural hospitals have definitely been greatly impacted by not having Medicaid expansion, where we've seen several of those hospitals close, which further creates barriers for access to care for many people. And again, I think a lot of the opposition has been that these people are not working individuals, and why do we have to do handouts? But want to stress that these are people who are working, individuals who make less than $18,000 a year for an individual. I think for a family of 3, it's right around $30,000 or $33,000 a year. And so really they don't work for a job that offers health insurance. They make too much to be eligible for Medicaid or MoHealthNet that we have in Missouri, and not enough to actually purchase health insurance. And so we know that with this option that those individuals who are doing the best they can will now have access, because we do consider healthcare a right for all Missourians. And then they can get things like treatment for Generate Health. We talk about moms and babies and the disparities that we see in the deaths of those individuals, and now access to care is one of the ways we can begin to address those disparities. So very important about framing that conversation and the importance of really getting out healthcare. There is opposition. There is a No on 2 campaign that has started. At this point, we have not heard a lot from that campaign, nor has it been fully funded. So hopefully we don't hear a lot from that. But definitely if you do hear opposition around the Yes on 2 initiative, and as you're talking about it, one of the key things we want to say is focus back on the core messaging of bringing access for 230,000 Missourians, emphasizing these are working Missourians. Part of the conversation about our budget, we can't afford it. When we actually know MFH has done studies to show that this will actually bring money to Missouri to help cover this. So really important that we not get lost in some of the negative energy, but really push our core messaging and our core values around Medicaid expansion. It's really kind of what we want to push there. So again, go out to yesonto.org for definitely more information, ways to sign up. They are doing phone banks at this point. They started last week. So a really big push with phone banking and texting. They're looking for volunteers to help with that. So if you are interested, please do reach out to them for that information as well. And I think with that, I don't know if I had any questions. I'm sorry, I was not checking the chat.
So does anyone have any questions? You throw it in the chat, or if you click on, you can raise your hand. You click on participants, and there's a little option to raise your hand if anyone has questions and they want to do that.
So I mentioned safe voting. Thank you, Kendra, for the reminder. I meant to mention that. Definitely during COVID, we understand that it is very difficult to want to be out. Sheltering in place has been the big thing. We've seen in other states where people have to stand in lines for long hours, hard to social distance. So we are really pushing for people as you go out, make sure they have masks. One of the initiatives that we've been working with is Prepare STL. They are doing voting PPE kits. So definitely if you want access to that, we can help get some of those kits out to your organizations and constituents. But definitely their kits, what they say, with masks. We have soap in those kits, as well as information about Medicaid expansion. And just emphasizing the fact, when you do go to vote, if you decide to go vote in public, that you are wearing a mask. As much as possible, you try to social distance, at least 6 feet apart from individuals. Take with you water. Please take plenty of water. Understanding that there may be long waits in line. It's gonna be a hot day. I'm in Mississippi right now. It was extremely hot here. I know it was a lot of rain in St. Louis, but definitely thinking about the weather. We want people to have, take with you water. If you are with an organization that is near a voting site, or if you are a voting site, consider having water available to people who come volunteer, having messaging up in your locations to make sure people are within 6 feet. If we can do this, markings as much as possible for the volunteers that are there for voting. I know one of the things that they're saying, the screens, they won't be able to clean them in between. So we want to make sure we have hand sanitizer with you as you go to vote, so you can use before and after you finish voting. Even I've heard people say to take the paper, that way you can take your own pencil or pen, a little bit cleaner, but definitely that. For mail-in voting, the last day to get your mail-in ballot was today. So if you did not get that, or if you have not reached out today, definitely you are option is to go in, and so make sure you have the precautions there. So those are the safe voting. Again, if you want PPE kits, we're partnering with Yes on 2 and Prepare STL to get out those voting PPE kits. I know Yes on 2 is planning to have water stations, getting volunteers for water stations at some voting sites as much as possible, really to our underserved areas, to make sure that people have what they need to vote.
Thank you so much, Angela. That's super helpful. There's information on the Secretary of State's website as well. And you look up your local election board, you can find some more information on the absentee and mail-in voting. You can't mail in the request now because I had to have received it by today. Like Angela mentioned, you can go to the Board of Elections office today, though. And again, make sure you're practicing all the safety precautions. There is another question.
I was just going to emphasize too, if you know people that have requested a mail-in vote, please make sure they get it in to this place by August 4th. So it has to be there by the August 4th deadline in order to be counted. And so I see this question. I don't know if, is it Tara? Can you speak to that a little bit more?
Yeah, go for it, Angela.
So I don't know, kind of the background of Medicaid expansion, just to see if I answer your question, what you're asking. Was it originally a part of the Affordable Care Act or Obamacare, and it was supposed to be implemented as part of that, and then the Supreme Court made it optional for states to implement. So our government, our legislators have not made the choice to implement Medicaid expansion for our state. And so this last year, there was a lot of energy. I think over the last few years, we've seen several states that have been able to pass Medicaid expansion with the ballot initiative. So Healthcare for Missouri over the last, I don't know if it's been a full year, but at least the last few months have been collecting signatures to be able to get this on the ballot. So again, this is our last, I don't know if it's our last opportunity, but really a big push to get the voters out. To really speak and kind of the conversation, are people deserving of healthcare, health insurance? You know, I think more that's a political issue. Is it a right? Kind of how do we help? But a part of this is that people feel like it's a handout, and how do we not help people that are not working? But really pushing that message that, oh, okay. Sorry, I read your question wrong. Working Missourians. Yes, and I think part of the messaging for the campaign to really stress the working Missourians is the fact that a lot of the opposition is saying that these are handouts. And so in order to counter that messaging is to show that most of the people who don't have health insurance now don't have it because their jobs are not paying for it. They have a disability. That is not that they're just not working, not trying to. They can't get a job. I mean, with COVID, we saw a large portion of our population lose jobs. So now they have no access to health care, which people can pretty much connect with. So I do apologize for misinterpreting your question. But that is kind of the idea of why they're saying this is working Missourians, for a lot of the messaging about these are people that are not working. This is a handout, to really stress that these are people who, for no other reason of their individual selves, would have health insurance if they could.
Thanks, Angela.
And hopefully that was clear. I misinterpreted the question at first, so sorry about that.
You're fine. And when we break out and kind of work on our individual whys, you'll get to kind of decide what messaging you want to talk about when you're discussing with your family and friends too. So if that's something that you're comfortable with personally, then you can kind of talk about it from a different angle. But thank you for answering that, Angela. Can you talk a little bit more about the phone banking opportunity? There was a question about that.
Yes, so phone banking, and it's not calling random people, really trying to get people to call people they know. So again, your friends and family, people in your neighborhoods, if you can do more of that, and that's kind of the start. It's a challenge of 10 people calling 10 people and challenging them to call additional 10 people. It's kind of the start. But also with the campaign, they have a larger phone banking initiative that they do training for. So if you're interested, definitely reach out and sign up for that. And then I think they give you a list of numbers and you just call and kind of do messaging about Yes on 2. And we do have targeted areas and zip codes that we are trying to reach. Again, a large portion of kind of the champions table I'm a part of is reaching people of color to get the word out, the messaging out to them about voting. And then Laura made a good point that I wanted to emphasize, that a lot of the messaging that we have been using has been tested across Missouri as things that resonates with people to help them get out to vote. The last survey that went out, we showed at least, it is a close percentage, but at least over 50% are in support of this initiative. It's really now just trying to get it out so people to really get them out to the polls to do the vote.
Awesome. Thank you. Last call for questions for Angela. Okay. I don't see any. Angela, thank you so much. We will make sure that, so Angela just threw that, her information and then the campaign website in the chat. We will also make sure that you have that in a follow-up email. So if you have questions or just want to get more information on the campaign, that website is super helpful. And then if you want to specifically reach out to Angela, we'll make sure you have her information as well. So thank you so much for that awesome information, Angela. It's super valuable and helpful for everyone. So I'm going to take a quick second so you all can see the toolkit that Generate Health has pulled together specifically around racial equity for Black moms and babies. So I'm quickly going to share my screen. All right, so this Medicaid expansion toolkit can be found on our website under the advocacy tab. So there's a whole tab dedicated to Medicaid expansion, and this is on there. So I just want to run through it super quickly, then we'll go into breakouts. So there's just kind of an introduction talking about why Medicaid expansion is important to Generate Health and our mission. So really highlighting the importance of breaking down a barrier to care that can be extremely helpful in pursuing racial equity in infant and maternal health. So really going into that importance. Obviously, Election Day is August 4th. So everyone just make sure you mark those calendars so that you get out and vote that day. Then we share a couple of data points that can be really helpful. So folks can really resonate a lot of times with stories, but then there's also folks that resonate well with numbers and statistics and data. So we provide some of those for you that could be helpful in amping up your why and your story and the conversations that you with folks over the next couple of weeks. So these could be helpful and are totally open for you to use. And there's some more larger talking points that are a little more narrative for you all. So thinking about healthcare as a privilege is not a privilege, but a right for folks, and how important it is to expand Medicaid to ensure that right to all Missourians. Talking about the importance for healthcare before, during, between, and after pregnancies for the health of mommy and baby. So talking through these talking points can be really helpful and resonating with a lot of our networks. We're going to do this Create Your Why together in breakout sessions. So we'll be working on that. Some of you may have already done that. And then we have some action pieces. Angela talked about a lot of these. There's even more as the campaign has been moving forward. So those phone banking and text banking opportunities are really helpful. And then we provide some sample social media posts for you. Again, with COVID, social media can be really helpful. It's also really helpful to like create a video of yourself talking about it. A lot of times people scroll past your kind of writings if you're just typing or have a paragraph or whatever. A lot of people may not read it, but a video could be really helpful. So if you want to just, or if maybe you're better at talking about it instead of writing, so that's another opportunity for you to share just a short video explaining to folks why this is important to you and why you will be voting yes on 2. And then just a quick sample email for you to be able to send out to family and friends. So if you wanted a little bit of help or just to make it a little bit easier on you, that's an opportunity to do that. So that again can be found on the Generate Health website, and we will make sure that we provide that in a follow-up email as well. So you'll be able to get to that. And there's a whole bunch of other resources as well that we share. So we definitely link to the the campaign website on there as well. And I can share with you all, we have an infographic too that you can see on our website right here. So this is really a better visual of some of those data points that are in our toolkit. So you'll just kind of have a couple of these data points in a prettier way to look at, and then just some ways to get involved. So this is something that it will be on our social media. I don't think we've put it up there yet, but that'll be shareable for you all as well. So there's a little bit more information and maybe an easier to digest way. So obviously there's a whole lot of ways for us to do this work. And it's really important for us to start out by thinking about what's important to us. A lot of times with our networks, some of the things that resonate the most are just hearing and sharing our passion with others about why it's so important to be voting on yes. And in the conditions that we're living in now with COVID, just simply getting people to go to the polls, and why it's so important to take the time and the energy and a lot of times kind of a stressful and scary situation to, if possible, to go and to vote on the 4th and to make sure that this passes. So we are going to break into some small groups for 20 minutes and walk through. We're going to start walking through the why and work on creating those together as a group. You'll be in pretty small groups led by a wonderful Generate Health staff member, and then kind of working on different ways that you can push that messaging out to your networks. So when we get back, we're going to have a brave volunteer from each group. So somebody volunteer, or you might get voluntold by a Generate Health staff member. Come in and report out really briefly, just like a minute, sharing 1 or 2 highlights from your group's conversation about when you're discussing your whys, and then offering 1 or 2 ways that your group came up with to help get out people to vote. So Sarah, are we ready for breakouts? Okay, and we can stop recording at any time too. Okay, so does anybody have any questions before we go into breakouts? Okay, cool. Sarah, send us away. Thank you again to our wonderful staff for facilitating these conversations. I hope you're all feeling a little bit motivated and excited about pushing Medicaid. I keep saying 2 weeks, but y'all, it's really like a week and a half. So this is important. So I am going to have each of us report out each group. I'm going to call the groups by your facilitator, but whoever your report out person is, again, super brief, 1 to 2, 1 minute, just a couple of points that you all talked about and with your whys, and then 1 or 2 things that you said you were going to be doing to take action and share your whys with other people. So I am going to pick on my group first. So Vicky is our wonderful volunteer, I guess you would call her, even though I told her. But Vicky, take it away.
All right, so I was lucky that I'm in Abby's group, so that means I have to work harder, right? Yeah, so what we really kind of resonated with is that we talked about like healthcare being a privilege. I mean, it's a right, not a privilege. And with all of the unrest that's happening in the world today, it really hit home that why are we even here talking about this? It is one of the rights, one of the basics rights. And Michaela kind of pointed out by doing research and her being a global person that it is one of the holistic things about health that we shouldn't just look at it just in our own bubble of what that healthcare looks like. Sometimes we don't think about it holistically, what that is. What we did talk about how we could get that out, and we all agree that social media is the best platform for us. Some tweets, which is really simple, fast, hit the masses amount of people. You can do it on your Facebook and Facebook Live, or even come up with your own story to your family about Medicaid expansion, and to talk to them about if they're going to the polls, what are their plans? You know, start that conversation. What's your plan today? Oh, okay. And then you can start talking about what Angela mentioned, some of those key points to get it out. I think that the other point that I want to bring up is that we spent a lot of time talking about the COVID pandemic and what it looks like to vote in this environment now, which is really something different, because we used to just talk about going to the poll and grabbing a buddy, getting in the car, carpooling together. But a lot of places have closed their polling sites that's really near people's home, where they walk to get, you know, to make their voices heard through polling, through the vote. But now, with that being the way it is, it's going to be a really big challenge for people, and especially a challenge for someone who could put someone in their car and take them to the poll. So I don't think we've all thought about that, but it's really going to look different this year. That's it.
Thank you so much, Vicky.
You're welcome.
Yeah, that last point is important. So note that in your heads. Getting people to the polls is an important question to ask. Okay, I'm going to keep calling staff out. Asia, who is your report out person?
It's me. Okay. So honestly, a lot of the stuff was just covered by Vicky, but so really quickly, just the importance of personal stories, and also just being aware that your story might change depending on the community you're in or the people you're talking to. Whether that is, like, if you live in a rural community, it might be more important to talk about, you know, those rural hospital shutdowns as opposed to, you know, the race disparities. Because that might just change. It might look different depending on where you are. Also emphasize, you know, that this is a right, not a privilege. And that hopefully because of COVID, everyone is realizing how important this is, that like everyone needs healthcare. And, you know, it is really important. We want to bring money to the state. And then similar about the voting, you know, all the COVID fear, but the positive side is that, you know, it leads to a little bit more creativity in, you know, not only educating other people, but also about like getting people to the polls, just like we talked about. So I'm complete.
Awesome. Thank you so much, Asia. Sounds like a great conversation. Kendra, who is for your group?
Miss Alicia Deal is our report.
Yeah, of course, of course. Hey everybody, hey. Okay, so basically, okay, some of you all had touched on some of the things that we had shared, talked about, but most importantly, what I had shared my story about how, you know, with the 60 days, and then after that I had to fight, and some of the clients who some of the provider had shared that didn't have the Medicaid, and they kind of like gave up because the paperwork, the clock that time was lengthy, and I just shared that I experienced that. But what the difference is that I pushed through. I kept going, no matter how difficult it was. I kept going. And so, and I shared that, you know, with the Consumer Advisory Board, we have a lot of moms who are on Medicaid, and many of them will be affected by that if the Medicaid expansion does not pass. And so, and then on the Facebook group, we also educate the mom how to vote. There are two ways to vote. You can vote in person. You can also vote absentee ballot. Actually, the notary and the submission of the absentee ballot is today. That's the last day today. And many of them are voting absentee ballot because they say, oh, this is the best way to avoid any, chance of getting COVID. Because many of their excuses was, oh, it's COVID. I don't want to catch corona. I'm like, that's why you have absentee ballot. And so I think that, the grassroots push is the best way to get the moms specifically to go out, because many of them are on Medicaid with their children, and educate them about the people that's on the ballot. Not just the initiative, but also the people, because the people make the decision whether those initiatives get on the ballot or not. And so we educate them on both sides and why it's important to vote. So that's pretty much what we talked about in a nutshell.
Awesome. That also sounds like a great conversation. Thank you, Alicia. So I think Marisha and Maliha, you two were together. Who was your person?
We've all told Tara as our person.
Good morning, everybody. So yeah, a lot of the same themes were reported or were shared in our group as well. All of us had a pretty easy time identifying our stories and our why, but varying ways in which we might get the word out. So some of us talked about talking to their neighbors and friends directly, either on the phone or just in personal interactions, talking to their coworkers in ways they may sort of share a story that they might identify with, so for example, someone in your shoes who's just a little bit under, makes a little bit more than, the minimum amount or the maximum amount, you've had a lot of struggles, right? And just sort of tying it back into like people who they know who have had personal experiences. We talked about social media being a way to share and communicate as well, letter to the editor. And then also our group identified challenges with getting people out to vote right now, and some stories they're hearing about concerns over COVID, or, maybe they just hadn't really ever voted necessarily. So how do they share information so that folks feel motivated and safe to go and vote? And if I missed anything, please jump in and speak up, y'all.
Great. Awesome. Thank you so much, Tara. So Brian, who is for your group?
We've got Katie reporting out for our group.
Awesome.
Hi, good morning, everybody. We talked about a lot of the same things and how it affects the moms that we work with, families we work with. We talked about difficulty finding coverage for co-pays and having limited access to physicians and providers that accept Medicaid, limited dental and mental health. We talked a lot about mental health and the importance of not making moms feel like they're nothing, don't deserve healthcare after 60 days. Definitely a lot about how healthcare is a right. And families just lacking that support for their children. Our action plan, the plans of how we will get the word out, talk to our friends and others about it. We talked about sharing in all of our many webinars and Zooms and meetings that we'll have over the next couple of weeks. And also trying to share the realities with folks who may not have experience with the people who this will help the most, and kind of clearing up any misconceptions that a lot of people outside of our field are experiencing and thinking that are not true. And I think that covers it.
Awesome. Sounds like you all had a really great conversation. So let's go to Carrie's group. Carrie.
Our reporter is Mia.
All right, Mia.
Can everybody hear me? Okay, what we touched
Yes.
on is being able to talk about it with in your circle of family, circle of friends. Also touched on serving prenatal and postpartum women of them knowing the benefits that they have with Medicaid, and if they didn't, you know, what would that look like if, like, after the pregnancy, after, because if you're breastfeeding, you know, you can still have your Medicaid coverage, like, you know, for so long. And if you lost that coverage, or if it wasn't expanded, where would they go? What kind of health insurance would they have? Who's going to advocate? What case manager can they go to, you know, and talk about it with? If you, well, like, we really don't have a personal, I really don't have a personal story, and some of the other ones didn't, because we have insurance on our job. But if we serving moms or families, you know, what kind of other benefits would they have if, you know, if it's on the ballot and it didn't cover a lot of things that, you know, like a lot of pre-existing conditions, a lot of hospital stays, you know, what would they look like? Where would they go? And y'all can jump in if I miss something.
Awesome. Great. Thank you so much, Mia. And then Michaela and Laura's group. Who was your person?
That is me. Vicky, who was our sole person in our group, had to jump off for work. So I'm going to report real quickly. A lot of the things that was already said, so I won't reiterate, but the highlights around that kids are at greater risk of not getting their health coverage, the care that they needed, were more specifically medications, and that there was a personal experience that Vicky was able to offer up that she would be sharing within her networks, and that the benefits of not just for pregnant women, not just during the 9 months they're pregnant, but also before and between pregnancies, the value of what that could mean for health and the outcomes, and that the expanding Medicaid would really be a lifeline for families. And the thought that many folks aren't familiar with a lot of the statistics of the eligibility threshold being as low as it is, and offering up these statistics along with the personal stories may be more impactful and help bring people in. And then getting the word out was really around tapping into your own group of friends and networks to be able to share those personal stories that would resonate. So that was what our group talked about.
Awesome. Thanks. I love a good personal story. A lot of people like to hear those and resonate well with a personal story. So something to keep in mind. I think the last group will be Rose's group.
Hi, this is Terry.
Terry speaking for us, yes.
Hi.
Awesome.
Hi. Some of the things we talked about of why to vote yes did include personal stories as public health professionals. We experience working with pregnant women, and this allows that ability to continue to stress the importance of healthcare. It opens up options and better education, not only for pregnant moms and babies, but also for healthcare professionals. Rachel shared a story, you know, that was gripping, where we need to also understand changes within healthcare professional and practices that need to change. So this allows for a pathway for empowerment and self-advocacy in maternal child health. Also, voting yes breaks down those barriers of who should have access. So the earlier references to privilege versus right, it is a right, and this opens up that conversation to a more equitable pathway. Voting yes is also an economic benefit. We want to continue to stress that this is an opportunity for more income to build the Missouri economy. It promotes more jobs. And then again, just another stark reality because of the risks of Black maternal mortality. As women of color, we don't want to die during childbirth. That is a very clear and stark reality. And this, again, is a pathway to helping to reduce that risk. We talked about what we were willing to do as far as action plans, very similar activities within social media, stressing the importance and the opportunities within social media. So being able to create videos, customize letters that we saw featured in the social media toolkits. One of our participants has already picked up yard signs. I need to get one today. That'll be on my task today. And then we also, again, shared, someone talked about the options for voting. We need to talk about those, reducing the barriers for voting. So the absentee voting, access to notary public services. That is also an option for those that do need to have that notary public. So NAACP it has services, as well as the St. Louis Public Libraries also have that available for residents if they do want to vote. And did I miss anything else, everybody? Okay.
No, that's good. I just put in the chat real quick that I loved Rachel Webster's quote, which was, "The first wealth is health."
Mm-hmm.
Like, your first wealth is health. It doesn't matter how much money you make or have. If you're not healthy, you can't enjoy it. So I love that.
Yeah, excellent.
Awesome. And I think we just had someone pop in the chat that they're a notary and are willing to help with that as well. So if you or someone you know has an absentee ballot that needs to be notarized, definitely you can reach out to Lauricia or there's several options, the libraries as mentioned, and those things. And I believe the Secretary of State's website has a list as well. So we can share that information as well in our follow-up email. It looks like it'll be a pretty extensive follow-up email, as I keep saying we're going to add things. So hopefully it'll be helpful information for all of you. If we can get it to work, I believe Sarah's going to put a poll up for all of us. Okay.
Oh, and Abby, real quick, I just wanted to add that I live across the street from a polling place. I'm in Southampton, 63109 zip code. It's right off Kings Highway. And I work from home. So if, I was just thinking, as we were talking about, providing water and masks, like that'd be a great way too. I could hand out stuff on my front porch or something, because I can see the parking lot from my dining room too. So if anybody has any good ideas for that too, feel free to reach out as well.
Yeah, definitely. That's a great idea. So somebody asked about where do you get yard signs? I think there are a couple of locations, but if you check on the Yes on 2 website, I don't know if anybody knows of any off the top of their head.
I went and picked up some. The ones when I signed up, the ones in the Brentwood location were out. So I went to the Urban League off of Jennings Station Road, I believe, up north. And they're just right there in the lobby. I didn't go into the building. I had a mask on, and then they just said that they are limited, so pick up what you need. So I grabbed 5, and then I have 2 out front. But yeah, super easy process too.
Awesome, thank you. And so on the screen you'll see our little Menti poll. So if you throw on your computer or your phone or whatever, and kind of say what you're going to do, and we'll see what we see for folks. Obviously, there are more opportunities. So anytime you have an opportunity to be having conversations or even mentioning something about Medicaid expansion, it makes a difference. If you can get 1 or 2 other people to get to the polls to vote for this, it really does make a difference. So every single vote counts on this. So the more people we can get out there, the better. So I want to thank all of you so much for being here, for participating, and for the work that you're doing, and for the work that you will continue to do to push Medicaid expansion over the next week and a half. staff. You all are awesome. Thank you for facilitating these groups and helping to pull all of this together. It's definitely a effort here. So thank you so much to our staff. And thank you to Angela Brown, who I believe had to hop off, but she provided some awesome information. We will make sure that you have her email if you would like to reach out to her with specific questions. She is happy to try to help answer those.
Abby, they're asking how to vote. Yeah, thanks, Laura.
How to vote?
On this poll.
Oh, sorry. If you go to menti.com and then you throw in that code that's at the top, 929661, then you'll get to enter that in. And so you should be able to do it on your phone as well as on your computer. And it looks like there's quite a few people. So awesome. All of these things you can do to share is great. I also like to recommend having a partner. I call them accountability buddies. Somebody you are working with another person and say, we're both going to commit to we're going to each text 5 people by Wednesday evening. Then you can check in with each other and hold each other accountable to what you were committed to doing. Please use our toolkit and information that we provide that is for you all. So feel free to utilize that information, those social media posts. You follow us on social media, you'll see videos and posts that are talking about our why and some of our partners' whys. Kendra's video is up talking about the Generate Health why it's important to Generate Health's mission to be passing Medicaid expansion. So again, we will be sending out a lot of resources in this follow-up email, so look out for that. And if you have any questions or want to dig into any of these topics deeper, please feel free to reach out to us. Again, thank you so much for being here. Do not forget to vote yes on August 4th and bring a buddy. It looks like we have folks who are really committed to doing a lot of different things to advocate for Medicaid expansion. So thank you for all that you're doing, all that you will be doing. And we will see you all soon. So thank you and stay safe. Everyone have a great day.